To kick things off, could you tell us what motivated you to study the long term sustainability of these daily huddles and process improvement efforts?
So this study, especially, I want to tell you a little bit more, is I was managing a program called the Master of Business and Operational Excellence, set up continuous improvement culture back in their organization. Several physicians from all over the US, several nurses, they've all came in the last 10, 12 years and started these kind of daily huddles where problems are discussed, problems are surfaced out, and even like continuous improvement culture is established. Leading and lagging metrics are not that uncommon for all of us. So if I'm a hospital and I want to like improve turnover, which is a lagging metric, we found that there was one hospital where they were focusing on reducing turnover among their primary care physicians, but they were motivating their employees saying, let's reduce the turnover from 18% to like say 10%.
Today, I'm absolutely thrilled to be joined by one of the co authors of a recent publication on how to sustain healthcare improvement initiatives in mixed clinical teams. We have Dr. Aravind Chandrasekaran with us from Ohio State University. He is the Dean of Fisher College of Business. Thank you so much, Dr. Chandrasekaran, for joining us.
Thank you for having me.
Thank you. To kick things off, could you tell us what motivated you to study the long term sustainability of these daily huddles and process improvement efforts?
Great. First of all, I want to echo thanks to you, Shubham, and the POMS community, because this kind of initiative of taking a research paper and then translating into like impactful like conversations, podcast, and then sending it and sharing it with business and practitioners is a great idea. That way, again, like they're very busy, they don't have the time to spend and read these papers with theorems and proofs and lemmas and data analysis. Rather, again, having a very short conversation could get some essence. So thank you for what you all do. And again, I hope this actually takes off as an initiative at pumps. So this study, especially, I want to tell you a little bit more, is my area of research is in healthcare operations, more particularly in the area of healthcare delivery. So as a part of that program, we had a lot of physicians and nurses. They come into the program and we tell them that you bring a problem and you actually throughout the program you're evaluated on how you're actually solving that problem. That's the capstone of the program. It's a very powerful way of learning. So in that program we've always had people come in, and then one of the things that they try to do is set up continuous improvement culture back in their organization. And several physicians from all over the US, several nurses, they've all came in the last 10, 12 years and started these kind of daily huddles where problems are discussed, problems are surfaced out, and even like continuous improvement culture is established. So that was the idea around that. But what we have seen is most often than not, they were doing it. They are starting to do these things. But if I were to call them after 6 months or 12 months to ask them, hey, how are things going on in your organization? Is the hurdles going on? They always give me an answer saying, yeah, it's not going well, or it's not really happening the way it started out. And that's not uncommon in healthcare and even other settings also, because a lot of times initiatives like huddles and things like that, which are very important to keep that culture of continuous improvement and innovation, they tend to like fail because of the complexity of what we have. Like in healthcare settings, things are actually like, again, there are so many things that are happening. Regulations are changing all the time. There is a lot of people turnover and things like that, which really means that there is a question on how to really sustain these hurdles even after a leader leaves the organization. So that was a very big motivator as I started looking at this approach analytically. I'll talk a little bit more about how we got this data, but like we also ended up doing some studies with very large organizations, healthcare organizations, and we found that it's very important. And some of these things that I'm going to talk about later is going to play a very important role to sustain these kind of initiatives in the organization.
That's fascinating. One of the big findings is that you have in the paper is around leading versus lagging metrics. Could you explain in everyday terms why letting different roles chase different metrics makes such a big difference?
Yep, very important for all of us. Again, leading and lagging metrics are not that uncommon for all of us. So if you think about it, we are all driven by metrics, right? We want to, and most often we're all driven by, in common man terms, they call as bottom line metrics. Okay, it's either productivity, profits, efficiency, customer satisfaction. I call all of those as what I call as lagging metrics. So in healthcare, for instance, a lagging metric could be reduction in mortality, readmission rates, and all those things. So why is it lagging? Is it lagging because by the time you actually see improvements in these metrics, it's too late again, like for me to like continue these things. So I'll give you a simple example, very simple example. In healthcare, like turnover is a very important aspect. Physicians turnover, nurses turnover, and all. So if I'm a hospital and I want to like improve turnover, which is a lagging metric, I cannot just have my people get motivated and saying, let's reduce that number. Let's reduce the turnover number in my hospital, because it takes you a long time to actually make impact on that number. Right. So in a primary care setting, to just an example, like we found that there was one hospital where they were focusing on reducing turnover among their primary care physicians. But they were motivating their employees saying, let's reduce the turnover from 18% to like say 10%. Now, by the time you measure it, by the time these things happen, it's too late. It's very lagged in terms of how it creates impact. Now, what we have to think about is you have to think about a corresponding leading metric that affects this lagging metric. So in a healthcare, in the primary care context, what I've seen is, again, they call this as pajama time. So people in the healthcare who are listening to me will understand this. Pajama time is the time that a healthcare provider spends after their shift is over, entering data into Epic, entering time, and again, entering information about patients and charting patients. So the more and more you try to do that after hours, you get overworked. And by the more and more you get overworked, you get burnt out. The more you get burnt out, you leave the organization. So a great example of for a burnout or a turnover in a healthcare, which is a lagging metric, is the pajama time, or the time that you spend on a weekly basis actually improving or like charting patients every week. Now, if you were to now go back and say to the same team, yes, you want to focus on the turnover, but you also absolutely should focus on a weekly basis how to reduce your pajama time, that the time that they're spending outside the work, to focus on charting. That becomes an easy problem. Then you're able to like say, how do I going to create more efficiency around patient charting and things like that? So you're going to minimize the time that the providers are spending outside, and by doing so, you're actually improving the lagging metrics. So that's an example of a leading and a lagging metric. Is the idea around lagging metric is absolutely important, because that's what gives you money, that's what gives you the reputation, that's what your customers care. But for every lagging metric, there is a corresponding leading metric, and that's what we discuss in this paper, is how do you now identify them and work towards both, not just focusing on one, but focus on both, so that you have more sustainability around these kind of initiatives.
You briefly mentioned about the staff turnover. You also highlight in the paper that staff turnover can actually be a make or break factor for these organizations if the turnover rate increases beyond what the hospital can handle. From your experience, what's a simple step managers can take to retain those key provider
Yeah.
champions, be it doctor or nurses or other staff members who keep this process improvement on track?
Yeah. And I'm not going to say something that's you don't understand. Like it's as simple as giving them that psychological safe space so they can actually work effectively is very, very important. Giving them, empowering them to have certain time, what I call as the I call this as the 15% rule, where again 15% of your time you reserve it to actually think outside the box and really like ideate and help your process get better. So giving them more time, not just having them to do this extra. I mean, like not that go and clock your 40 hours a week and then give me 6 more hours of things after the 40 hours. You're not going to get a lot of buy-in. But rather than that, try to like make sure that you're only working for 34 hours, and then helping you like the remaining 6 hours you're actually spending on how to improve your processes better, in a way that you're actually now next time you do it, you're creating more efficiencies in the 34 hours in a way that you're actually doing it better. Right, the idea on inculcating those kind of ideas is very, very, very important. So I see more and more there are some organizations that have started to do this. I've consulted with several of them, but there is a lagging need. Not all of them understand that. They just say improvement is something that has to be outside the work. What I see is it has to be inside. It has to be built into your work. And how do you do this more effectively is the way you actually can win these things.
That's very true. So let's talk about leadership a little bit. Many managers tend to celebrate quick wins and then shift their attention elsewhere. In your view, how can clinic leaders or hospital managers avoid that trap and give process improvement the runway that it actually needs?
Yeah, and that's what our paper also shows is that what happens is oftentimes you celebrate the quick wins, and then once that win is dead, you reprioritize. You end up doing something else, and that actually loses the focus around this, right? Like, so one of the things that we try to find, and we this again, like a lot of these analytical inferences that we got from the system dynamics model in the paper, is based on some of the field work that we have done. So one of the things that we find is instead of if you're reprioritizing things, you still have to empower your frontline. You still have to make sure that they are responsible for the existing culture that they've created. So as long as your managers and your leaders are able to empower them, and then it's okay for you to like move on to other initiatives as long as the frontliner has the ability to still make those changes. So one thing I talk about like in this paper and beyond is like if you were to think about continuous improvement and all, it has to be driven by metrics. So again, like those metrics cannot change every day. It's saying that metrics have to be aligned with what your organization wants. So as long as you're hitting those metrics, it's important for you to empower your frontline so that like even if you shift from one metric to the other, they still have the ability to still improve those metrics. So that ability to empower other frontline people should be extremely essential with a metric driven attitude in the way that you can avoid these kind of failures.
Yeah. And you also mentioned reinforcement in your paper to reinforce the metrics. So, for listeners who are eager to get started, what are your top two pieces of advice to make sure those daily hurdles don't fizzle out after the first few months?
Yeah, so a couple of things. Very, very important is like the whole paper is based on the idea of, again, it's a heterogeneous team. What I mean by heterogeneous team is very rarely you're going to have a group of same people leading an initiative. It's going to be a group of people. It's going to be like a nurse manager, a physician assistant, or even a receptionist in a healthcare context. In a factory floor, it could be a plant manager, a frontline worker, and someone else, a division head, someone else. So meaning like you're not going to have the same people. So one of the ways to make sure that you are not falling into the trap of like lack of sustainability is to make sure that everybody's voices are heard. Like when I do some work with the field teams and all, I say rotate the leadership in the huddle every day. So meaning in the healthcare context, it could be one day the physician in charge is leading the huddle. The next day it's the nurse in charge leading the huddle. The next day it could be the receptionist leading the huddle. That way, everybody is owning the continuous improvement. It's not just the physician in the room or the plant manager in a manufacturing setting or like a customer complaint reporter in a service setting. It has to be everybody is in charge of the continuous improvement culture. So that is very important. Rotating the hurdles, making sure everybody owns it, not just one person, is important. The second thing is it has to be metric driven. Like again, you can't just come in every day and say, I'm going to continuously improve without having any what we call visual reinforcement. So when we do these kind of initiatives in healthcare, I ask them, what are the top four metrics that you care about? And again, you've got to be very careful in this. You can't have 20 metrics because if you have 20 metrics, you're not able to improve a lot. So I would say identify four KPIs. Anything more than four, you're struggling. So that four KPIs, which I call lagging metrics, have to have the corresponding leading metric. So that already makes your metrics eight. From four, it becomes eight. So that alone is a big thing, right? Like, and then every time you huddle, you're actually focusing on the eight, right? Like in healthcare terms, I always say very start with the patient. That's always the important thing. So what does the patient care? It could be patient satisfaction, patient seen on time, patient left without being seen. There's so many things out there. Then something that has to do with the efficiency of your process. Again, like it should be like how many patients we are seeing, how many labs you have done, how many test results you have processed. Then the third thing is all about providers. Again, like are your providers burnt out? Are there any faults that are happening in the organization? So on and so forth. And the fourth thing is bottom line. I mean, like at the end of the day, you can't run an organization without thinking about efficiency and like avoiding waste and all. So that'll be there. So think about those four metrics and then think about the corresponding leading metrics, but that's plenty. So that's one way to start is like rotating leadership and having a visual driven approach with these kind of selected metrics will allow you to sustain some of these initiatives over time.
Beyond the hospital setting, when I was reading the paper, I realized that these process improvement strategies that you recommended in the paper can very easily be implemented in other sectors, other industries. Can you pick a few examples of where these strategies can be used?
Yeah, I mean, like I give you example of assembly line auto
Hmm.
production system. I have actually personally done some work where I've been to some very big manufacturing automobile plants in India, where I have seen these kind of initiatives where they do daily huddles, and they would do like what they call even monthly, like two times a huddle with the morning shift and the evening shift, with very similar approaches, having to rotate the leaders, creating very clear KPI. So in manufacturing setting, people have done it even before a lot, but I think the importance of rotating, having these metrics is something that I've seen very coming up in some organizations. I've seen this in like IT teams in a lot of ways, a lot of agile teams when they do IT work and like data analytics work, there is a lot of these things happening. I've also seen in hybrid teams. Now we are in this environment where no longer you're going to have people in the same room. So I work with a very large insurance company that does something like this hybrid wise. So they have three or four in the office, three or four that are actually working off site, but still, again, the rotation around leadership, making sure everybody is involved, having a clear visual reinforcement can be done. So again, the application of some of these things that we find in healthcare actually are various places, and I've personally seen some of these things happening in IT, in insurance companies, in like manufacturing settings, in customer call centers, and so on and so.
I completely agree. Thank you so much for sharing your
Sure.
insights and for giving our managers or our listeners a clear roadmap to keep improvements alive long after the first victories.
Yeah. And I just want to like also personally thank my other co-author. He couldn't be here, Professor Edward Anderson from University of Texas at Austin. So he's also been my co-contributor in this work. He's been working with me in various of the projects, but I'm so thankful that he was able to like be the analytic mind in this paper, working on the system dynamics model and so on and so forth. So it's both a very valued contribution from both of us.
Perfect. Thank you so
Okay.
much,
Thank you for having
Dr.
me. Okay.
Chandrasekaran.
Take
And
care.
thank you to our listeners for listening to this wonderful initiative. And I hope you take something away from this. Thank you.